Welcome back to Path to Med. I'm your host, Suhani, and this is episode 7. So today I'm joined by Dr. Aumkar Lad, who started his career as a critical care registered nurse before attending the University of Medicine and Health Sciences in the Caribbean, where he earned his Doctor of Medicine degree. And he is now a resident specializing in anesthesia. So it's great to have you on the podcast. Thanks for being here.
Thank you.
So my first question is kind of just when did you first start considering a career in medicine?
So that's a great question, actually. When I finished high school, I never wanted to do medicine. It was one of those things that evolved over time. So initially, I wanted to do something in like engineering, maybe, or like computer sciences programming, because I was good at that and I was good at math. But then I also wanted to help people. And I was looking at the many options that I realized that I did not want to sit in a cubicle or in front of a computer for hours at end. And I wanted to interact with people. And I did my research. Nursing seemed like the best option for me because I was good at sciences and mathematics, so like hard sciences. And with that, I felt like I could make a difference in people's lives, and then I also would have a job afterwards at the end of my degree. So nursing seemed like the best option for me at that time. So therefore, I ended up doing nursing, and then eventually transitioned into critical care. And then I fell in love with critical care over there. And then eventually after that, my path led to medicine.
Nursing is definitely really like people focused and people oriented, I guess. So
Yeah,
there's a lot
yeah.
of like face-to-face interaction. Do you think that you had like an accurate idea of what working in healthcare would be like, or did it kind of surprise you later?
Oh, definitely. It was different. Healthcare is, very physically stressful as well as mentally stressful.
Mhm.
Healthcare is one of those things where you end up developing this camaraderie with your coworkers, and you just become close to them because it's just how you end up coping with them. You start making friends, you start hanging out with them. Then even the most stressful days seem okay. You can function, you can help people out. But I don't think I expected that much stress going into nursing, but most definitely it's one of those things that you learn over time. It makes you a stronger person, I feel.
Yeah, yeah. So why did you decide to pursue nursing before transitioning into medicine? Was it like the kind of people aspect or?
Yeah, it was mostly the people aspect and the science aspect. I love sciences. I found myself doing very well in sciences in high school. So when I looked at the options, I was thinking about me doing Bachelor of Science and, just as an undergrad or health sciences or something. But none of them appealed to me as much as nursing did because, after Bachelor of Sciences, you end up kind of getting stuck sometimes. And then, you don't really have a backup plan. And then for me, coming from an immigrant family, I wanted to have a solid base so that I could help family out as well. So nursing seemed like the best option for me at that time. And when I went into nursing, I was expecting really like just hard sciences, but it was a mix of social sciences, a lot of social sciences, to be honest. But it was a great learning experience. It helped me grow as a person as well. And yeah, after nursing, life was tough because work is not, what you expect
Yeah.
from a regular, 9 to 5 job. It's different. So you have to be able to do night shifts and day shifts, 12 hours on end. Some days are busy, some days are not, you have to be able to manage all that stuff. But yeah.
I've heard of a lot of people telling me that they want to go into it because of like the stability sort of aspect. Um,
Yeah, most
Because
definitely.
need doctors and nurses, they'll always like it's kind of
Yeah.
a job that's always going to be there. So, yeah.
Actually, a lot of people do say that, as a joke. I don't mean it as anything else, but as a joke, people could say that, you know, healthcare is one of those things that can never go out of business.
Hmm.
Even in recession, people will get
Yeah.
sick, there's always someone who needs help. And the
Yeah.
biggest aspect of, healthcare, I think is one of those fields where, especially medicine and nursing,
Hmm.
that you get compensated well enough and also you are able to help people. It's one of the few professions in the world where you get to do, you get benefits of both worlds. And
Yeah,
it's a and also it humbles you a lot because it makes you realize what other people go through rather than just your own struggles. It makes you realize your own struggles are nothing compared to what,
other
people are going through
people.
in life. Yeah.
Yeah, for sure. You said that after like health science, for example, or like a Bachelor of Science, that a lot of people get like stuck. What do you sort of mean by that?
So when I was, so this was back in the day, back in like
Yeah,
2010, 2009, when I was looking
yeah.
into it. I'm sure the prospects are different now, but back then, a lot of people that I spoke to who were from an immigrant family, they would be like, yeah, we do Bachelor of Science and everything. And then they graduate from Bachelor of Science. They all told me, or my parents at that point, they don't really have a job. They don't really know what to study afterwards. I'm sure there's jobs available and, they would apply and then they would not get anything out of it that, they found fulfilling enough. So looking at all of that stuff, I'm sure like people with Bachelor of Sciences are able to get really good research jobs and pharmaceutical jobs and all that stuff too. Um, but that's not where I wanted to end up
Mhm.
because that's again one of those things where you can't help people. So my primary goal was to be able to help people, and that's why I ended up choosing Bachelor of Science in nursing. And then at the end of the day, I would still have a bachelor's degree, but in nursing, and I would still be able to help people out. So that's why I ended up choosing that. Yeah.
Yeah, yeah. Like you were kind of set for after that with like a
Yeah.
job.
Once I chose it, yeah, once I chose nursing, I was like, this is what I want to do. I'm gonna go
Mhm.
through it, and I'm gonna do my best. And that's where I ended up in nursing. Yeah.
Yeah. Would you recommend like other healthcare related careers like nursing or like paramedics before med school or not necessarily?
Of course, yeah, yeah. During my medical school, I found a lot of people who had done like physiotherapy, emergency, like EMS, and
Hmm.
then healthcare aides. There were a lot of them. There were a lot of scribes. They worked as scribes in the ER and stuff.
Hmm.
So a lot of people came from a variety of, backgrounds in medicine. So that's what makes you special, I feel. And doing anything in healthcare before coming into medicine, it's great. Even a bachelor's degree gives you a solid foundation about what you want to do in medicine. It gives you that experience and background to figure out what you want to specialize in, to be honest.
Especially if you're committing like years and years of your life
Yeah,
to
yeah,
like studying.
hmm,
I guess it gives you an idea of like what you're getting into. So,
yeah.
yeah. So how did your nursing career kind of help you in medical school, if it did?
Oh, I think it helped a lot. The biggest thing I think it helped me with is giving me a sense for clinical reasoning. Especially during my first 2 years of medical school, the questions they ask are very, wordy, lengthy questions, especially for board exams. And they don't get to the point, so you have to figure out what they're asking for and what is relevant. So being a nurse, especially in the ICU, would help me, figure out, okay, this is important, this is not important, this is what I need to pay attention to, this is what I should expect, and all that stuff. So given all that, I felt it gave me a really good foundation for clinical reasoning, and helped me give an edge, especially during my clerkship years. And also skills like starting IVs, ultrasound IVs, using the ultrasound. Just being familiar with patient interaction was very
Mm.
advantageous to me.
Yeah, yeah,
That one. Yeah,
yeah,
definitely helped me a lot compared to other students. And it made me stand out actually. So
yeah. I
it helped a
mean,
lot.
like you brought a unique set of skills already, so yeah. Medical school, there's obviously like the content's really heavy. So do you think it helped you with like study skills and stuff as well? Like,
Yeah, most definitely it did. Definitely medical school content, it's insane.
I've
Um,
heard.
yeah, but nursing school's content is pretty much the same. It's just
Mhm,
instead of hard sciences, you get, your soft sciences like social sciences and stuff, and
mhm.
psychology. It's a lot more heavy, especially the school that I went to at Ryerson, TMU.
Yeah.
Um, It was very heavy on the social science aspect and psychology aspect and nursing theory aspect. So it was heavy over there and it was heavy here. But you know, it your my experience in nursing school really helped me as well. And also it taught me to learn how to learn. I think the
Hmm.
biggest mistake that people make coming into medical school is they know what to learn, they just don't know how to learn.
Hmm.
So if you can learn how to learn, it puts you ahead of everybody else.
And it's different for everyone too. Like I feel like what works for you, so it takes a little bit of effort to kind of
Yeah,
figure it out,
yeah.
which is why it's
It's
hard.
it's a lot of tweaking, and sometimes
Yeah.
I remember I still do this, to be honest with you. I will go back and forth with my study strategies. Some days this strategy works, some days the other strategy works better. So you're constantly changing, and I think if whoever's in medical school or is gonna go to medical school, I think the best advice is don't be afraid of change. If the one strategy is not working, by all means switch to another strategy the next day or something.
Yeah.
It'll just help you be better.
Yeah. So what was your experience like going to medical school in the Caribbean, specifically?
I think it was fun. It was fun because it was warm.
The weather? Yeah,
It
I can
was the weather
imagine.
was really nice.
Must be
You know,
nice.
yeah, it's like even the beach was like maybe like a 10-15 minute walk, not bad. So and then it was warm weather all throughout, well, most days. So you feel happy. You can sit outside and study. You can hang out with friends, group studying, and then I was lucky that my school had really good professors. So they really taught well. That gave me a solid foundation for my board exams and my rotations. So it really helped.
I've heard in the Caribbean that there's like medical school tiers, but I don't
Hmm.
know a ton about like what those are. So like do you think you could talk a little
Yeah,
bit?
yeah, most definitely. I think so for medical schools, so there's I think like four or five big ones. You got your St. George's, you got your Ross, you got your AUA, AUC, and then SEBA. I think those are the top five big ones. Uh, my school is not as expensive as those schools. Now, my school was initially started by the same family who started Ross University and then sold it to like a what is it called, like a corporation or something.
Yeah.
Yeah, so it's run by a corporation. So, but since they know the business of medicine and the medical school in the Caribbean so well, they started this new school, and I felt, I was in good hands that, if something I needed help with, they would always like work something out for their students and stuff. Especially like if you're not an American citizen,
Hmm.
they usually look out for you and like help you out. So that's why I chose my school compared to those five. Um, One of the biggest things that prospective students can look at is obviously your finances and stuff, which school you can afford. So my school was relatively inexpensive, still expensive, but relatively inexpensive compared to
Yeah.
those big five schools. um, but the other thing you should look at is accreditation. Is big, especially for US residencies. So these five schools are accredited, I believe. And then my school is fully accredited. Some are partial, some are fully. I know AUC is fully accredited. AUA was fully accredited at one point, but there was some issue with their accreditation. I'm not 100% sure. There's a website that you can look at all of this stuff. But yeah, that's why I chose my school. It was because it was fully accredited, and they knew the business inside out. Um, and then obviously look at the alumni, where they match and what's their match rate like, what's their USMLE pass rate like. So it gives you a lot of information about their school.
So are the tiers kind of based on like funding and I just forgot what I was I lost my train of thought.
No
Oh,
worries.
funding and tuition fees. Like is that kind of what the determines the tier or
So the medical schools usually, so the big tier medical schools, they have more affiliations with hospitals, so they give you more spots for rotations. And when you rotate at other different hospitals, you have exposure to different specialties at different hospitals. So that gives you more opportunities for interviews, more exposure, and increases the chances for matching. So these big, expensive schools, they typically have more affiliation. So it actually helps you to match
Yeah. Yeah.
or increase the chances for matching. Yeah, that's what I wanted to
Yeah.
say.
Yeah.
Yeah.
So what was it like applying for residency after going to school there?
Yeah, so in the US, we have to apply through a system called ERAS, and we match through the NRMP, so National Residency Matching Program. So it's this algorithm that we match through. So during my time, they changed the whole, like they added these like gold, silver, and like bronze stars or something like that, where you had to give like ratings to each of them, and then according to that, you get your interviews. So it was a very different experience. It wasn't like the past ERAS matching stuff. But they I found out after that that they changed it again this year, so it's different again. So they keep on changing it and experimenting on it for now. But it's a very what do I call it? You apply to so many programs, and next thing you know, you just get like a bunch of rejections. You get acceptance from a couple of programs, and you get a bunch of rejections for
Yeah.
interviews. So like you're like in a limbo, like okay, I hope I get more interviews to increase my
Yeah.
chances for matching and all that stuff. But yeah, it's an experience in itself. Yeah, that's how I would put it. Yeah.
So why did you decide to do your residency in the US versus like Canada or elsewhere?
Yeah, actually, yeah, that's a good question. I think so. My initial plan was to apply for to US and Canada,
Hmm.
but after I started medical school, I think COVID hit, and after COVID hit, Canada decided to do its match after the Canadian match, after the US match,
Okay.
and typically it was Canadian match would happen first, and then the US match would happen.
Uh-huh.
Uh, Now, when I applied to a US, so before, if I applied to both, then if I didn't match in the Canadian program, I would automatically be matched into. I would keep my name in the US match, and I would most likely match in the US because the chances of matching in the US are higher.
Hmm.
But since it was after the US match, it didn't really make sense for me to apply to Canada for matching as well. So I just ended up applying to the US, knowing that there was a high likelihood that I was going to match in the US, and I didn't want to spend that time and finances applying to
Yeah.
Canada at that time. So, but now it's back again. Now Canada match is happening first, and now US match is happening
So
afterwards.
they switched it back.
They switched it back
Oh,
recently.
okay.
Yeah,
Maybe it was like a COVID thing. I'm not sure.
could be, could be.
How likely is it for grads of Caribbean med schools to match into residency versus like grads of like an American or Canadian med school? Do you think it makes a difference or
I'm not sure. The NRMP usually puts out stats, to be honest.
Mhm.
I don't remember the stats off the top of my head, but most of them usually do end up matching. They don't have any issues. Um, you know, what they want to see is like hard work, determination. Your knowledge is good, and you're a good person. You just get along with people. Because the last thing they want is they want to match with someone who does not want to be there or does not have a good personality. So if you just hit those points, usually you end up matching in a decent program.
especially because you're like working and learning from a lot of other people.
Yeah,
You don't want to deal with difficult people, so
yeah, yeah.
yeah, for sure. So you'd say like it doesn't really put you at a disadvantage if you're not
There is definitely, a little bias against Caribbean students because, they're not from this US or Canadian system.
Mhm.
But I find in my experience that most people that do go to the Caribbean or are from international medical schools, they're typically harder working, they're more knowledgeable, sometimes more experienced. They come from various backgrounds than just, your typical undergrad. I'm not degrading them, but like
Yeah.
compared to your typical undergrad, they have more vast experience. They sometimes bring more to the table compared to the typical US or Canadian grad. But yeah, sometimes there's bias. Most times, you're more than welcome. They actually like international students, most programs. So yeah,
That's good to know.
yeah.
Um, so what do the people that don't match into residency do? Because Um, that's kind of a big fear, especially after like the 4 years of med school. So,
Yeah, most definitely. I think, they do have a backup thing if you don't match the first round. I think there's like one or two more rounds that you go through to match. And usually people, match into any other residency program that they're interested in. It usually works out for people. Sometimes it doesn't, unfortunately, or fortunately. But even if it doesn't, I think it's okay because you can always reapply a couple more times. You can always increase your chances by doing a research year or shadowing a physician or a program that you're interested in. The other thing you can do is, if you don't end up matching, is you can do like non-clinical stuff. So you can work in pharmaceuticals, insurance companies. You can be part of nursing homes, retirement homes. Many different opportunities are there, especially on the business side of things. So that can open up a lot of doors for you too. So it's not
that's
the end of
actually
the world.
right.
Yeah, that's after medical school, you graduated and you didn't match. There's always other options. It's not the end of the world.
That's good to know too.
Yeah, yeah.
So what drew you towards an anesthesia, like specialization?
Funny question. The reason being, because just like how I did not want to do medical school before, I never wanted to do anesthesia.
Funny. Wow, okay.
Yeah. Yeah. So when I was in medical school, I was doing my rotations at the hospital, and I was doing surgery, which is about 3 months, and then OBGYN, which is about 3 months. So you're always in the OR in and out. So
Mhm.
one of the anesthesiologists over there would always see me coming in early and leaving in late, staying for cases that are even late cases. Typically medical students are like told to go home and they just end up going home. I wanted to learn and I wanted to be there genuinely because it would help me be a better physician in the future, right? So he saw my hard work, he saw my determination, he heard some good things about me from other physicians and stuff. So he asked me, like, one day I was just sitting waiting for a case to go to the OR. He's like, "What do you want to do?" I told him that I wanted to do internal medicine and maybe critical care because that's what my background was as an
Yeah.
ICU nurse. He said, "Why don't you do anesthesia and then critical care?" I was like, I don't know. I don't see anesthesia as a
Yeah.
specialty that I could see myself in. It's like, why don't you do this? Like he did try to convince me a lot. I kept on saying no. He's like, just do a rotation. He's like, just do a rotation, set it up, and then see if you like it. If you like it, great. If you don't, it's okay. So after a lot of hesitation, I was like, maybe I'll just do a rotation. So I set one up, did my first day, and I was sold. I realized this is what I wanted to do exactly. There's nothing else that I want to do in my life.
Just
Anesthesia is
immediately.
my just immediately like that first day, that first case in the OR, and I was like, this is what I want to do. So I fell in love with it, and knock on wood, it worked out.
How do you what do you think is a good way to kind of figure out what specialties for you? Obviously for you it was like kind of like getting a glimpse into different ones and like
Yeah.
um but yeah, how do you kind of go about doing that, I guess?
Yeah, I think it's all about like the lifestyle that you want, like I don't know much about Canada, but in the US, typically if you're like internal medicine, OBGYN, surgery, your subspecialties, hemo, cardio, and all that stuff, you typically have patient follow-up even after you go home. You get phone calls from insurance companies, your pharmacy might call you or page you, your nurse's office might call you or page you for something urgent or not emergent. So a lot of you end up taking your work home, and that's something I did not want in my life. Like I always wanted to do a specialty where if I'm working, I'm working, and if I'm home, I'm home. So I think two specialties that came to my attention. One was anesthesia after I did the rotation, and the other one was emergency medicine. So I was between those two when I applied. So I dual applied um, when I did my application for residency,
Oh,
and
okay.
luckily I matched into anesthesia. But that was the thing that I was looking at. Like the biggest thing for me was the balance for lifestyle. So if I was home, I did not want to think about work, and if I was at work, I wanted to be at work, and I did not want to bring my work home. So that's why I chose those two specialties.
So you kind of just have to think about like what lifestyle you want and then like work backwards and figuring out like
Yeah, yeah. And then also what do you like? So if you like critical care, those hours are also brutal. Like I like critical care. You still have long hours depending on what hospital you work in. Some hospitals, if you're a resident, you're the only attending, you're on for the whole week, 24/7. You get paid in the middle of the night. You have to wake up and answer the resident's call for any questions that may arise. So otherwise, if you work in a community, you have a little bit of a balance because someone covers you during the nighttime and you're just there for the daytime. And some rotations you would do, 24 hours during the week, one to two 24-hour shifts during the week, and you're also on during the day. It really depends on what type of balance you want.
I guess you could talk to people that are working in the job too to kind of figuring out to figure out what they like and don't like about it, to hear it from
Yeah,
them.
that's also
That probably
that's actually
helps.
that's a
Yeah.
very good point that you make. Yeah.
Do you think that there's a lot of big misconceptions that people have about becoming a doctor?
It's not as glorious as the TV dramas make it seem.
Hmm.
It's definitely has its good days and it definitely has its bad days. Um, Bad days are not always the patient outcomes. Sometimes it's just the workload that you have managing patients, and it can really drain you. Sometimes you have good patient outcomes and it still drains you. So it's not as glorious as the medical TV shows show them to be.
Grey's Anatomy.
Grey's Anatomy, your ER. I think the most recent one right now is The Pit. I think that's
Yes,
pretty
I've heard of it. I've
pretty
heard of it.
realistic. Yeah, pretty realistic about. I saw maybe like one episode or something so far,
Someone
and it
recommended.
seemed, yeah,
Yeah.
pretty accurate, I would say.
Yeah. No, it's definitely I mean it is interesting for sure. I feel like you don't know I guess what it's like until you're working in that environment, I guess. So it's kind of a
Yeah,
shock to some people.
yeah.
Um yeah. Did you find that there was any challenges transitioning from nursing to medicine, or was it a pretty smooth kind of integration?
No, no, I think there were some challenges, especially in the way of thinking. You know, when I first started my rotations, it was like I was so focused in the way of nursing thinking is like, okay, this is the problem. I need to do this to solve the problem. But in medicine, you have to take a step back and try to look at the whole picture. And I'm not saying nursing doesn't do that.
Mhm.
Nursing does definitely take a step back and have a look at the whole picture, especially when you're like seasoned and experienced nurse. But me being just, I think 2, 3 years of experience in critical care, I had to do this constant switching. So like if I was working, I had to think like a nurse, not like a doctor. Otherwise, I would not get anything done because nursing can become very task oriented, especially when it gets very busy. And when it gets very busy, sometimes you do not have time to think. You just have to do to help the patient out in that moment, you know? But medicine forces you to take a step back, think about the patient as a whole, and like, okay, what's going on with the patient? What's the underlying cause of this? And how can I manage the patient and help the patient feel better? So yeah, the two different thoughts in my experience, at least. I could be wrong. Someone might have
Yeah.
another experience, but for me, that was the issue.
That probably takes some adjusting to, especially after working for some time. So I guess learning that probably took a
But
bit.
yeah, definitely.
Yeah. So for people in high school who are kind of unsure about whether they want to go into medicine or not, what are sort of some ways that they can explore the fields or healthcare and kind of figure out if that's for them?
That's a good question. I think exposure is key. Yeah, I think I would say exposure. I think I wouldn't have done medicine if I wasn't exposed to critical care nursing. So I think exposure is key. Like maybe being able to shadow your family doctor or any physician that you may or may know, or nurse practitioner or nurse for that matter. Um, Volunteer in the hospital setting to see what it's like. Observe people. You can always research. YouTube is so vast now. You can always find a
Yeah.
video about people's
Yeah.
experiences and stuff, so you can get a lot from there. Reddit has been more recently been active about, if you're interested in a medical school, there's always subreddits or like nursing or physiotherapy or anything like that. There's always subreddits out there. People ask very good questions, and really gives you an insight from people's experiences. Yeah.
What flipped the switch for you and made you like confirm your decision and know that you didn't want to do engineering and go into healthcare?
Uh, I think I tried to be as realistic as possible.
Mhm.
Because at that point I did not want to do medicine. So when I chose nursing, I think the biggest factor was helping people out, and next thing was having a job afterwards. So I computer sciences would have a job afterwards, engineering would have a job afterwards. But um, for me, I wanted to be able to talk. I sometimes like talking to people, especially like small talk, just to make them feel better. They're in a stressful situation. So, thinking about it, I think the biggest factor was helping people out and having a job afterwards. Those are the two biggest factors that I was looking at
Yeah.
when I switched from, doing engineering or computer science into nursing.
Is working in like a US hospital different from working in a Canadian one, or are they pretty similar?
Some aspects are very similar. Some aspects is different. Like, for example, Canadian healthcare is socialized, so it has its own challenges. US healthcare is privatized, so it has its own challenges. You have to deal with a lot more with insurance companies in the US. Sometimes it feels like they dictate the care versus, a physician dictating the care. In Canada, it's less likely the case. Since it's socialized medicine, the physician usually dictates the care. But there's other aspects of Canadian medicine that, hinders patient care as well. So it is, grass is greener on both sides, but different parts of the grass are greener.
Yeah.
Yeah.
Do you think that like has that impacted your sort of career in any way, or is practicing kind of the same wherever you do it?
Yeah, medicine is very similar. Practicing of medicine is very similar. It's just the system that you practice in
Like
is
the
slightly
patient sort
different.
of experience.
Patients are also very similar. I wouldn't say they would be different between the two. Um,
Just like the
like
structure.
yeah, the structure of healthcare is different. Like
Yeah.
privatized versus socialized, they each have
Mhm.
their own challenges. So how do you navigate as a physician to best help your patient? That's the biggest question. I as a physician tend to ask whenever I'm practicing.
Yeah, yeah. Do you think that there's any like qualities or skills that people should sort of start developing, I guess, if they're thinking about like healthcare or medicine?
I think the biggest thing that I have to do is start early. And when I say start early, I meaning start your MCAT prep early. Get your Kaplan books or whatever MCAT books that you're interested in. If you do something in physics, chemistry, or bio, find that concept in your MCAT book and review it. Do questions on it. Be familiar with the concept, content inside out. And then you would do the same thing during university as well. So keep reviewing back and forth. Keep going back and forth. Do questions. Volunteer early. Shadow physicians early. You have to get your letter of recommendations for medical school. So finding a physician that knows you well enough to write a very strong letter would make a huge difference. So these are all the things that you need to work on, especially extracurriculars if you want to match into or get into a Canadian med school.
This is kind of my like last question, but do you have any like final advice or like final words for anybody that's in like high school or undergrad who's thinking about a medical career?
Yeah, good question.
I'm sure there's a lot, but if you have to
There's a
narrow it
lot.
down,
Yeah,
like yeah.
there's a lot actually. I think the biggest thing is, if know early. And even if you don't know early, it's okay. Like I was a mature student going in. But if you know early you want to do medicine, start your prep early. Get your eggs in order, meaning like your volunteers, leadership volunteers, give back to the community. Those are also very helpful. Looks good on your CV. Start your MCAT prep early. Read a lot of books, especially for your cars section. It will make a big difference. Um, and be prepared to work hard and don't give up. Yeah.
Good, good suggestions and advice. Yeah. Well, thank you so much for taking the time to do this. I'm sure you're really busy. That was really, really helpful. So thank you.
Thank you. Thank you for having me. It was a pleasure.
Thank you so much. I had a lot of fun. I learned a lot. So thank you.